I'll tell my colleagues to listen to government, and I also tell government to sincerely sit down with them. And this time around, when they sit down, meet their agreements and stop making promises they won't keep. This strike is a resumption of a strike that has been suspended over 100 days ago. And in that 100-day period, nothing was done. Hazard allowance still where it is. And then a lot of house officers, even though they say they will be centrally paid, have not been paid. There are a lot of issues. So, but it's unfortunate that strike has to be the option at this point in time. What they can do, how is cholera transmitted? Cholera is transmitted through fecal-oral routes, contamination of water, bad water. So government should improve on the drainage. When there's rainfall, you see the whole streets are flooded and there's no good drinking water. That's how cholera is transmitted. So if they can make sure there's good drainage system, good potable water, things will get better.
If you look at it, since the outbreak of the cholera, a lot has been done in terms of sensitization to educate people on the proper hygiene, especially as to regard to day-to-day activities, and also towards improving the consumptions, either for domestic or commercial purpose, the food items we are using, in terms of continuously covering it, and also the fact that we are also encouraging people to report quickly to the hospitals whenever we have a little outbreak. This will allow the early intervention and allow measures for treatment to be instituted and save lives. But by and large, a lot of there is collaboration with National Primary Healthcare Development Agency to provide medicaments that can be used in primary healthcare to improve. Other issue also is the NCDC, Nigerian Center of Disease Control, who has the mandate of checkmating and controlling and also supporting state in terms of control of outbreak of infectious disease, has done a lot. Just a few weeks ago, they have dispatched a lot of specialists to different places that are affected with this and with the aim of trying to find which actually the strain of the organism that is causing this outbreak of vomiting and diarrhea. But by and large, we encourage people, Nigerians, to pay more attention to proper hygiene and taking as much as possible safe drinking water. Everything is open now. The government cannot do it alone. We are calling on locally and international partners to come and help government. And I know even the government, that's why at our own level in the House of Representatives and National Assembly in general, we are calling for health security preparedness so that at least we can have certain fund that NCDC can be in the possession of the NCDC that can be used immediately when you have issue of outbreak like this so that it can be utilized. Not only that, you also have completed at the House of Representatives, and it has been passed to for concurrence to the Senate, the amendment of National Health Act 2014, with recommendation that the Basic Health Care Provision Fund, that was at least 1%, should be increased to at least 2%. This increment will provide more funds, at least for certain organizations like the NCDC. And also we are hoping even some of our research institutions will benefit from that fund so that from time to time we'll be monitoring and documenting all this issue of outbreak in a timeline fashion. Advice is for the resident doctors to listen to us. We have already, my committee has invited them for a dialogue. You know, we have been an arbiter for negotiation with two stakeholders, the resident doctors and the federal government, and that has been ongoing. We agree that what happened now, there are some issues of delay somewhere, and also there is miscommunication, because from the information that are available to me, much is done, but much is also not known. So the meeting on Monday is going to be a holistic one. We are going to take issues one after the other so that we can address them. We are ready to apportion blame on wherever it falls. The issue is that it's just too much on Nigerians. We have hardship in terms of economic hardship. We have hardship in terms of insecurity. We have hardship in terms of inflation and what have you in the country. Now, more than 80% as it is, or 75% according to WHO. The healthcare procurement in the country is out of pocket. And now the subsidy is to get it from the government. If the government establishment in terms of hospital are closed down, it means an average mass of this country will have nowhere to go, and mortality is going high. And that's why one cannot even be surprised that in the last 1 week, the death accruing as a result of COVID is on the increase. Probably the strike has limited the accessibility of access to healthcare by Nigerians, and also what can be done to take immediate measures. So I do advise, and I call on resident doctors to please temper justice with mercy and reason with us. Those areas that I've mentioned, that where we have much is done, but there is communication gap, will be made open to the resident doctors on Monday. And I do hope that the message that will come after that meeting will be enough to convince them to call up the strike in the interest of average Nigerians.
The ARD National should temper justice with mercy, and please consider the ongoing strike, for the fact that we are having a start phase of COVID-19, and we are having cholera outbreak in most of the states, including the FCT. So since I was made to read that speech, and it was written there, so I just want to reiterate that, and that will suffice what the minister would have said if he had come here. Let me also sincerely thank Dr. Sonunu, who has been so wonderful when we had issue with our resident doctors in the SCT. He did all humanly possible, including bringing all the ministers, the Accountant General of the Federation, and everybody that mattered in this country to talk to the SCT administration and the SCT resident doctors. And because of his intervention, the strike was called off, and we were able to resolve most